Good morning, everyone. Welcome back to Atlanta and Company. I'm Christine Pilara. Right here in Georgia, there's a facility that specializes in helping to bring new life into this world. Reproductive Biology Associates was established back in 1983 as Georgia's very first IVF treatment center. Their list of physicians have a combined 170 years of experience in diagnosing and treating infertility. And joining me this morning is Dr. Michael Witt, who specializes in the treatment of male infertility, sexual function, and urology. Welcome to the show, Doctor.
It's great to be here, Christine.
170 years of experience. That is a lot of years. And this is something that I feel like in the last 5 years since I was trying to have children, so many friends are touched unfortunately by infertility. What kind of patients do you treat specifically?
The patient that comes to me is the husband in the equation, who obviously plays an equally important role to the wife. So I typically will see the husband. Obviously, I'll see the couple together, but my focus primarily is to address any issues that the husband may have that's making it more difficult for the couple to establish a pregnancy. And
break it down for me. How common is male infertility?
Well, of the 15% of couples that suffer from it, about 50% of the time there'll be a male factor that'll be contributing.
And when should somebody seek help? At what point, when the couple is trying to conceive and they can't, should they say, you know what, you need to see a doctor?
Yeah, the rule of thumb is that most couples should try on their own at least for 6 months. And then if not successful, obviously both should seek help. But if the couple really suspects there's a problem, and sometimes they do, then really they should seek help as soon as they really think they need it.
And what can a man expect when they come to see you? Because I know that's got to be a little unnerving. So talk about some of the things that you do at the office and what happens during a visit.
Yeah, well, one of my roles is just to make the husband feel sort of comfortable and really enroll them in the process, because many times a lot of the attention has been focused on the wife.
The female, yes.
And so it's important to kind of bring them into the whole process. But my role is to evaluate them and to move beyond just doing the testing, but to really go into his history, do a really thorough exam.
Lifestyle,
exactly,
habits.
And look for things, one, that he can do to prevent the problem or help the problem, and then provide options if a problem does exist.
And let's talk about what can be done. What are some of those options?
Well, for men, the good news is there's a lot you can do now that we really didn't have the tools to treat in the past, but the most important thing, at least for the man, is to optimize his lifestyle and eliminate all those factors that might be having an impact.
No smoking, for sure, right?
Exactly.
I read that when we were trying to get pregnant.
That's right.
No smoking and...
No smoking, really minimal amounts of alcohol.
No, I was about to say, limit your drinking.
Yeah, and really the most important thing is weight reduction in our current culture, because obesity is rampant, and that's starting to have a significant impact on male fertility.
Well, I had read when we were trying to get pregnant, poor Jim, I was reading all these books. I was like, no hot tubs, no tight underwear. Are those kind of wives' tales, or is that all true?
I mean, there are some urban myths out there that you sometimes have to re-educate the husband on or free them up from, because there's some things they can get pretty obsessive by. But obviously the things you mentioned, like smoking, you want to be sure there's no recreational drug use that's taking place. And then really look into other factors that a lot of people are using currently that they're unaware of having an impact. A big one is antidepressants, which a lot of people are taking that can have a pretty significant impact on male fertility. And then try to implement into their sort of diet and their lifestyle things like activity, multivitamins, those kind of
What are some myths surrounding male infertility?
Well, I think the biggest myth is that the male isn't the problem, and that's slowly eroding. But I think the bigger problem now is that most men think if I just have one sperm, then that's enough. But that's really not the case. You really need one good sperm.
Exactly.
And so the critical thing is being sure that that context is created.
Okay. And give us some good news about the numbers, because I really do feel like over the years there have been such dear friends of mine who have tried and tried and tried, but through the blessings of IVF, it has happened. It may not happen overnight, but people who never thought that they could conceive, they have children. In fact, I have some friends who they're having twins now, and she wouldn't have even thought that was possible years ago.
No, that's correct. I mean, we see a lot of patients now that currently really would have had no other option other than to be childless or go to adoption. And I think couples who come in, let's say with really poor success rates on their own, if nothing was done, really can expect probably at minimum a likelihood of success of about 50%. And for most couples, what I'll counsel them, because it's such an emotional process, is really perseverance.
Right.
Because if they persevere, many times it's going to be a very rewarding experience at the end.
Absolutely. Thank you so much. It's always a pleasure having you on. Such great information. We appreciate it.
You're very welcome.
And if you would like some more info about Reproductive Biology Associates, please give them a call. Pick up the phone. It's 404-257-1900, or log on to their website at rba-online.com. rba-online.com. And this segment was paid for by Reproductive Biology Associates.